Rural communities in the United States are increasingly bearing the brunt of the obesity-related cancer crisis. While cancer affects people in all regions and socioeconomic brackets, the gap between rural and urban health outcomes has grown stark and, in many cases, deadly. One of the clearest examples of this divide is in cancer mortality, where rural residents, especially those living with obesity, face higher risks of late-stage diagnosis, limited treatment options, and ultimately, poorer survival rates. A major factor is the lack of access to early detection services. Screenings for cancers such as colorectal, breast, and cervical are essential in catching disease at a treatable stage, but in many rural areas, facilities that offer these services are miles, sometimes hours, away. This means patients must travel long distances, take time off work, and cover transportation costs just to get basic preventive care. For low-income or elderly residents, these are often insurmountable obstacles. As a result, cancers that could have been caught early frequently go undetected until they are advanced, aggressive, and far more difficult to treat. Obesity compounds the problem by raising the risk of developing certain types of cancer in the first place. But the rural healthcare system is not equipped to manage this growing burden. Many rural hospitals lack specialized oncology services, and some have closed altogether due to financial strain. In these medical deserts, even those who receive a cancer diagnosis may struggle to access timely chemotherapy, radiation, or surgery. Referrals to urban centers can take weeks or longer, and delays in treatment are known to lower survival rates. Prevention is similarly compromised. Healthy food options are often limited in rural areas, where convenience stores and fast food may outnumber grocery stores. Physical activity can also be constrained by a lack of recreational infrastructure, such as parks or community centers. Public health initiatives that promote healthy weight and lifestyle choices are often underfunded or entirely absent. When preventive services are sparse, and when obesity is allowed to worsen unchecked, cancer becomes an almost inevitable outcome for many at-risk individuals. Education and awareness efforts face their own challenges. Misinformation, low health literacy, and cultural stigma around weight and disease can all inhibit proactive health behavior. Many rural residents may not be aware of the link between obesity and cancer, or they may be discouraged from seeking help due to fear, fatalism, or past negative experiences with the healthcare system. Building trust and delivering culturally appropriate messaging is essential, but difficult to achieve at scale, especially when public health departments are stretched thin. It's also important to recognize that rural health disparities are not only a matter of geography, they are a matter of policy. Underinvestment in rural healthcare infrastructure, inadequate Medicaid expansion in many states, and the chronic shortage of primary care and specialty providers all contribute to the widening cancer mortality gap. These are preventable deaths, but preventing them would require meaningful, sustained efforts from state and federal governments, efforts that have not been made consistently or equitably. The result is a dangerous and accelerating crisis. Obesity-related cancer deaths in rural areas continue to rise, not because these cancers are inherently more aggressive, but because the systems needed to prevent, detect, and treat them are broken or missing. Ignoring this trend risks further deepening the inequality between urban and rural populations. While urban centers move forward with advanced therapies and integrative care models, rural patients are often left with delayed diagnoses and fragmented support, if they receive care at all. This is not simply a healthcare issue, it is a moral and societal failure. The rising tide of cancer deaths in rural America should not be accepted as inevitable. Until policymakers confront the systemic neglect of these communities, more lives will be lost to conditions that are both preventable and treatable. The cost of inaction is not just measured in statistics, it's measured in lives cut short, families devastated, and communities hollowed out by preventable suffering.